Suffer from the following symptoms: stabbing pain in the feet or hands, burning pain, numbness or tingling? If so, you may have neuropathy and should be screened as soon as possible. Please call us at 949-859-6600 to reserve your screening time. Time for the screening are limited, so please call today.
And welcome back. And we have on first, we have a segment from Saddleback Memorial. We have Dr. Linda Chung. She's a board-certified OBGYN with Saddleback Women's Medical Group in Laguna Hills. Welcome.
Thank you very much for having me.
Nice to see you today. And looking a little bit of your background, I saw that you went to Stanford University, so not far from where I grew up. I did not go to Stanford, but I did grow up very close by there. And you went to UC San Francisco, which is where my brother went, and you were down in Houston for a while, and now you are here working at Saddleback Memorial. So tell me a little bit about your practice, and you're talking about gynecological health after 55. Is that what you specialize in?
I specialize in gynecology only, so I'm actually no longer doing obstetrics, so not delivering babies, and seeing women for all aspects of their gynecological care.
Okay.
Yeah.
All right, so we often hear that women reach a certain age and they go through menopause. Obviously, this isn't something that I personally will know about, but explain maybe a little bit of what happens and what changes, and you also hear about the hot flashes and things like that. Can you give just a little brief overview of what women, when they reach that age, whatever it is, I know it's probably in your mid-50s or something, when this usually occurs, and what they should start to kind of notice and look out for?
Well, the menopause transition, which we call perimenopause, can start in the mid-40s and can last for up to 10 years.
Wow.
The actual definition of menopause is when menses cease completely for a year, and that can be, again, as early as in the late 40s, and some patients are still having regular periods into their mid-50s. But the average age is 51 of actual menopause. And certainly hot flashes and night sweats are two of the most common symptoms of menopause, and irregularity of menstrual cycles, which tend to get further spaced apart and lighter, and then eventually stop altogether.
Okay, what are some of the symptoms that should prompt a visit to a gynecologist?
So for women who are age 55 and above, one important symptom that should prompt the visit is bleeding after menopause. Certainly irregular bleeding can happen during the transition, but once periods have stopped altogether, if there is any bleeding that occurs after that, you should definitely see a gynecologist. Postmenopausal bleeding is often an early symptom of uterine lining cancer, also called endometrial cancer. It's the fourth most common cancer in American women, and one that actually is highly treatable when caught early.
Okay.
Yeah. One of the evaluations that would be included is, of course, when you see your gynecologist, a physical exam. A brief office procedure called an endometrial biopsy is often done, and a pelvic ultrasound might also be included.
Okay. With men, you often hear about when you reach a certain age, usually the mid-50s or so, maybe 55 to 60, you should start going in maybe once a year to check for prostate cancer. Is this something women should look at as far as looking at uterine cancer? Should they start after a certain age going in? Obviously, it's good to go in and have a physical once you reach a certain age on a yearly basis. So is this part of that regular exam or something they should do?
It's not a routine screening exam, meaning it's not something that we have a specific schedule for. And one of the, if you can say there's a good thing about cancer, one of the good features about uterine lining or endometrial cancer is that it does present with an early symptom. So if women come to see their gynecologist in a timely fashion, if they have abnormal or postmenopausal bleeding, then these rather simple or easy to tolerate exams can be done to rule that out. So because there's an early presenting symptom, we don't screen all women on a regular basis, but as long as they come to see their gynecologist, and even scant bleeding is important to come see your gynecologist for. And while I certainly stress the importance of taking postmenopausal bleeding seriously, I also want to reassure women that there are certainly benign causes of postmenopausal bleeding, so it doesn't mean that you need to be afraid immediately that you have endometrial cancer.
Okay. Is this something that this type of cancer, are there certain factors that may lead to it? Hereditary, maybe how many kids you had, or something like that?
There are actually. Certainly there is a hereditary component. There is a cancer syndrome called Lynch syndrome, which makes women more prone to endometrial uterine lining cancer, also to colorectal cancer. So those two are linked. So if there's a family history of early colon cancer or uterine cancer in the family, that's important to bring to your gynecologist's attention. Also women who have a higher body mass index or who are obese, women who potentially have diabetes are at increased risk of this cancer.
Okay, all right. What about, I've heard about hormone therapy after a certain age, and tell me a little bit about that and what you look for and when that therapy should start and maybe how long it goes on for.
The pendulum has swung back and forth a lot on hormone therapy. The current guidelines given by the American College of OBGYN are really sort of somewhat vague recommendations, but it is this. It is that postmenopausal hormone therapy be used at its lowest dose and for the shortest duration needed to control symptoms.
Okay.
So one big change from the past is that we really try not to have women stay on hormone therapy indefinitely, and that our goal really is for women to stop as soon as they're able to tolerate. So this is a very individualized process because, as you can imagine, by that guideline I just discussed, there isn't a specific or determined age at which hormone therapy has to be discontinued. But we know that there are risks associated with hormone therapy, and large studies have really clarified this a bit more. And the serious adverse outcomes or the serious risks, which include an increased risk of heart attack, blood clots, and strokes, really occur in women who are on postmenopausal hormone therapy in their 60s.
Okay.
So in my practice, I try and have women be off of hormone therapy before age 60. But the decision to start hormone therapy, how long to continue, and how to discontinue are very sort of individual and personal decisions. So I really try and talk with the patient about what their specific goals are for that particular therapy, and then come up with a personalized plan of how long and how we would eventually discontinue.
Okay. I have another question. This is this may be sort of off your particular topic here, but I'm just curious, and
Sure.
as I said, this isn't something I
You're not expert on
I'm
this?
not an expert on. But you hear about, and I don't know the exact name of it, but the vaccine that are often given nowadays
Yes.
to young girls.
Yes.
Sometimes when they're first born or their first series of vaccines, they ask it, but typically it's to girls who are teenagers, and I forget the name of it, but it's to prevent-
Gardasil.
Gardasil. Is that something that helps prevent any cancers as you get older? If you're in your mid-50s or 60s, can a woman take that and have some benefit there?
Probably not, or at least as it is currently recommended. That vaccine is recommended for women up to age 27 and was actually recently recommended or cleared for boys as well.
Yeah, I've heard that,
Because, so the vaccine is a vaccine against the human papillomavirus, which has many different subtypes, and the vaccine contains within it 4 of the most common subtypes of protection for those 4. And the vast majority of infections occur in early life. So what the studies have shown is that really the greatest benefits occur when vaccines are given at a younger age, and that at this point it's not really indicated for women who are in that age 55 and above group. Now that may change. The vaccine is highly effective, seems to have very minimal side effects, and we are actually finding other cancers that are HPV related. You might have heard of the Michael Douglas story.
Right, exactly,
Exactly. So that may be an expanded indication that we don't yet have, that it will take additional studies for. But I think that's a really fascinating field, because even when I was in medical school, the idea that a virus can actually cause cancer was kind of radical. And then to find a very specific virus that causes very specific cancers that we now actually have a vaccine for is really exciting. And I haven't been in medicine all that long, but I've seen how that's changed. How something that was sort of an idea in medical school now is a huge reality and may still have expanded applications. So that's one of the really great things that I enjoy about my field.
When you were down in Houston, were you practicing down there?
I was.
Okay,
yeah.
And then you decided to come back to California?
Yeah, I'm a longtime Californian. I grew up in the South Bay, and as you noted, all my education was in Northern California, and my husband's from California as well. So we finally made it back, and really happy to be in Orange County.
Good, and you are based right over here at
Yes.
Saddleback?
Yes.
All right, very good. A lot of great information. One last question is, when women are going through menopause like this, is there also, and I know this may not be specific to what you do, but are there other symptoms, or can they feel depression or something like that? Or those might be signs that if they don't, that they may have the onset of menopause, or if something hasn't quite changed yet, are there certain things that they should look out for or start to feel? And that might be, you said it can last a year without having their periods. If they go 6 months, is that a time when they should think, well, is this happening to me?
Yes, so because the transition really has a wide variety of normal variations, the definition of actual menopause is 6 years without a period, but that what we call the perimenopause transition, peri meaning the time surrounding menopause. Certainly it can be 6 months without a period, and a woman can have very severe hot flashes and night sweats. Some women may have a full year and realize, oh, I've not had a period and I don't really feel that differently. And both are very, very normal iterations of what menopause can be. Hot flashes and night sweats are probably the most common symptoms, but certainly mood changes, metabolism rate changes. A lot of women find that they seem to gain weight more during perimenopause, skin, hair changes, vaginal dryness. All those things are part of the symptomatology of perimenopause and menopause.
All right, well, good, great information. And if someone wants to get a hold of you, they can call their main number at 1-800-636-6742, or just think of 1-800-MEMORIAL. And then from there, you can ask for Dr. Chung. Great information. I think I learned a lot.
Well, I'm glad.
Certainly stuff I didn't know about today.
I hope that was helpful.
I like to learn about things. Pleasure meeting you and having you on, and being that you went up to Stanford, my area up there, and it's a great area up there, but we're glad that you're here at Saddleback.
Thanks so much. I'm happy to be here.
All right.
Thanks for having me.
Folks, we'll be right back, and I believe next now should be Phil Duran.
Clear and never old. The birds are chirping hello, and you know that it saved me. Well,
we can keep you healthy and care for you when you're not, right in your own backyard. Memorial Care Cancer Institute at Saddleback Memorial. Together we'll put cancer in its place.
A drive down the coast on a perfect day is the essence of freedom. The road, the view, the pure joy of driving. Can it get any better? Yeah, it can. At South County Lexus, we'll show you how you can make driving fun again. Because here, the journey means more than the destination. And the right car makes all the difference. South County Lexus at Mission Viejo. Different.